Yeah, as a general cardiologist, the patients that I most commonly see have coronary atherosclerosis, and that leads to blockages in the heart arteries and can sometimes cause heart attacks or injuries of the heart muscle. And then the patients I see, we're either trying to stabilize those artery problems or dealing with the problems that those heart attacks have caused. For example, the heart not pumping right. And when the heart's not pumping right, that leads to a condition called heart failure. So we're trying to adjust the patient's medicines to help the heart work better. Another common thing that I interact with patients about is if they have what's called valvular heart disease. All patients have 4 heart valves, and we oftentimes see that they're not working right. And so we have to review with the patient why their heart valves aren't working right and what options we have, either from a medicine standpoint or a procedure standpoint, that we can do to try to get those heart valves to work better and allow the heart to pump more efficiently. Sure. So the typical interaction with a patient, both in the clinic and in the hospital, is to first hear about their symptoms. To a cardiologist, it's very important for the patient to be able to describe what's bothering them, such as chest pain, shortness of breath, or funny feelings that they have regarding their heart rhythm. So that's a significant portion of the visit, is to hear from the patient what's bothering them. Then we complete a physical exam, focusing on the lungs, the heart, and the blood vessels. And then after completing that exam, we're able to look at a lot of diagnostic material, such as EKGs, pictures of the heart that have been acquired in different ways. And then we synthesize all of that information together to come up with a care plan. And one of my favorite parts of the interaction with the patient is trying to share that knowledge with them so that they can kind of understand what is going wrong with the heart and how we want to treat that. A nice thing about working at this time in history is that most of these fancy images of the heart that we acquire, we can share with the patient on the computer or on a tablet, and it's really helpful to be able to get them to see their own heart, how it's working or not working, and allow them to be a part of the decision-making process about how we want to move forward to try to make the heart work as efficiently as possible. So I think the most important part of the interaction is making decisions with the patient's input about how we're going to either evaluate or treat the heart. Sure, a couple of common examples in cardiology. One is when the rhythm of the heart becomes irregular. Fortunately, the way the heart was designed, normally the electrical system is a very smooth and regular process, but sometimes it gets disoriented and irregular, and that condition is called atrial fibrillation. And so a cardiologist has to not only diagnose that problem, but then determine what would be the best intervention for that problem. Sometimes it's just pills. Other times it can be procedures that include like cardioversions, where you put some stickers on the patient and shock them. Other times it can be invasive catheter-based procedures. So that's the role of the cardiologist, is to counsel the patient on what they think would be the best intervention. Another example that we commonly see is called mitral regurgitation. That's a leaky heart valve. And we have a series of valves in our heart, 4 valves that are supposed to be one-way valves. So they're supposed to just let blood move in one direction in the circulation, but sometimes they don't work right and they're leaky. So the job of the cardiologist is to diagnose that problem and then to determine what is the best way to manage it so that it doesn't cause a problem for the patient. And again, oftentimes that can be medicines to try to make that problem be less impactful to the patient, but sometimes it requires intervention such as a catheter-based procedure or surgery.
And prosthetic valves, or is that common?
Right, yeah, prosthetic heart valves would be open heart surgery to replace a heart valve that's not working right. So those are very important decisions that you have to try to work through with the patient to explain why you think an important intervention might be necessary. And then the last common example is unfortunately atherosclerosis is common not only in the heart arteries, but can be present in all the vessels of the body, and it often manifests with blockages in the arteries that go to the legs. So patients will complain of pain when they're walking because they're not getting good blood flow to their legs. And a cardiologist can assist in diagnosing that problem and then determining what options, again, medicines or sometimes catheter-based procedures or sometimes surgery, can help that problem.